this was a sub-study of the CARTITUDE-1 trial. CARTITUDE-1, just to refresh your memory, uses a BCMA CAR product, JNJ4528, now called Cilta-cel. This is the same CAR that was originally used in the LEGEND studies in China. And so CARTITUDE-1 was a phase 1b/2 study that was carried out at United States centers in heavily refractory patients getting a single infusion of cilta-cel after fludarabine Cytoxan conditioning, and showed very high response rates. And so this was a sub-study of qualitative interviews for patients who were sort of going through CARTITUDE-1 and were willing to get interviewed either before treatment about their expectations, and then post-treatment around day 100 and day 180 after getting the CAR T-cells. And so a total of 36 patients ended up participating in these interviews, sort of pre-treatment day 100 and day 184. And I think the main takeaways from this, number one, that patients, majority of them expected this to improve their symptoms and induce a remission, but several of them actually had hopes or expectations for a cure or extended life expectancy as well, which I think was interesting to see, and not something we typically sort of expect in late line therapies, and shows sort of the high bar that patients are looking for CAR T-cell therapies. And then certainly in terms of symptoms, the most common symptoms were pain and fatigue and bone issues, as well as sort of neuropathy and some GI issues as well. And those symptoms significantly decreased after cilta-cel treatment. Particularly pain and fatigue were the ones that really improved the most, particularly by the day 184 visit. And then patients also reported an improvement in health-related quality of life in terms of emotional and psychologic function, the ability to participate in activities of daily living as well. And then in terms of how cilta-cel sort of met or didn't meet their expectations, actually a majority of patients, anywhere from 70 to 78%, felt that it either met or exceeded their expectations at the day 100 or day 184 time point. And actually a majority of patients felt that this treatment was actually better, if you will, than their most recent treatment they got prior to cilta-cel. So I think it just provides additional supported data to the clinical data in terms of the safety and tolerability, just showing that this actually does have an impact on patients' quality of life. And I think that's the nice thing about CAR T-cells in general that really differentiates it from some of the other drug therapies where you have to stay on these drugs continuously, is that if you really do get a good response to CAR T-cells, you get that treatment-free interval, that break from therapy that I think rarely happens in late-line myeloma. And patients really seem to appreciate that.